Natasha, I know you've been following the data surrounding the vaccine rollout much closer than most of us. Is there an easy answer here when it comes to who is to blame for that rollout being slower than planned?
Yeah, look, it certainly has turned into a bun fight. I think the core of the state's fury, really, I think it could fairly be described as, is the fact that these figures have been released by the federal government which show the sort of amount of vaccine they've been given versus the amount that has been administered. And in percentage terms, for instance, New South Wales, the figures showed have administered 55% of doses that they've been given. The substance of New South Wales's complaint seems to be that they got sort of dumped these 40,000 doses of vaccine one day, and then they went into the sort of figures that the federal government's using in terms of how much they were supplied, but they couldn't, of course, administer 40,000 doses within, a couple of days, and they need to plan these things and book people in. So that seems to be the core of their complaint, that they didn't know how much supply was coming until virtually it arrived. They haven't been able to plan for it, and these, doses have been included in their figures that they literally haven't had the time to roll out. Queensland's argument seems to be similar, but they're also claiming that they've only received sort of a couple of days' notice most of the time about what sort of quantity of vaccine they'll be being given. But they also have this second sort of war with the federal government over second doses, and they're claiming that because of this lack of certainty of supply, they have had to hold back some of their Pfizer quantities to account for second doses. Now, that doesn't seem to make a lot of sense on the face of it, because the Commonwealth has only been distributing 50% of what it's received from Pfizer. They've been holding back the 50% for second doses. So the supply issue doesn't seem to have a bearing on whether or not Queensland actually needs to hold back those second doses. And they're sort of putting that up as an excuse for the fact that their vaccine rollout was initially slow, and they've had these two medics in Queensland, the doctor and the nurse that have caused these latest COVID outbreaks, who have actually been working on COVID wards even though they're unvaccinated. So they certainly have a reason to sort of throw mud, if you like, over this issue, but I'm not sure that their argument makes a hell of a lot of sense.
Yeah, it was an extraordinary news conference today. I mean, Brad Hazzard, the New South Wales Health Minister, demanding an apology, saying he was furious. He said that this is the angriest he's been throughout the entire pandemic, in a situation where we know there has been quite regular stoushes between federal and state governments. We know that more broadly health policy, and particularly the blame game over the delivery of health services and hospitals, has been one that has been bubbling along for many years now between federal and state authorities. This one, though, really was just, that was really opening it up, wasn't it? We know that the federal government has been arguing, well, we didn't get the supply in from Europe. It's really been reverting to that line every time it's asked about the slow vaccine rollout. It seems, though, confident that the pace will pick up. Prime Minister Scott Morrison saying again today, we can be confident that by October, all eligible adults will have had at least their first dose.
Yeah, and I think the pace definitely is picking up. We saw 120 vaccines administered by GPs in just 1 week, and that brought our total vaccination doses up to 500,000. If you think about it, a fifth of those doses in 1 week delivered by GPs. They're really steaming along, and I think that they will be the powerhouses of our vaccine rollout. But I think this bun fight between the states and the Commonwealth, of course, it's always thus in health, but I think that it's particularly unfortunate because here we've got these issues of federalism playing into a really important national rollout. The release of these figures really that we saw today have prompted this fury from the state governments, but it's sort of telling that these are the very figures that they actually sort of argued and successfully fought in National Cabinet not to have published. So they're very sensitive about this information being made public. But really, we need this transparency. We need a lot more transparency than we're getting about how much vaccine is being delivered. I've put questions into health departments right around the country and received virtually no answers on how many people in phase 1A have so far been vaccinated, how many of them are quarantine workers, how many of them are healthcare workers. We need to know this information, because if we're getting outbreaks coming from our hospitals because healthcare workers have not been vaccinated, we really need to know how many of these healthcare workers are yet to be vaccinated. And that's the information we just can't get.
Just looking at the Brisbane lockdown, the signs looking positive that it could be lifted tomorrow at 5 p.m. as planned, with just a couple of community transmission cases today. We've also seen that new case of community transmission in New South Wales, in Byron Bay. It's interesting, isn't it, to contrast the approaches by the Queensland government and the New South Wales government. New South Wales essentially saying today that masks are mandatory. It's introducing a few restrictions for 4 local areas around that Byron area. But the restrictions, essentially, they're saying, it's up to people to be sensible. They're not going to be enforcing movement restrictions, for example, in and out of those affected areas.
Yeah, well, we've seen yet again this New South Wales model in action of really relying on widespread testing and contact tracing. It's worked in the past. Their contact tracing is obviously absolutely top-notch. And they can have a lot of confidence that they will be able to contain and ring-fence this outbreak without further spread, simply because their contact tracing is so superb. Now, in Queensland, I think it's unfortunate that we've seen another lockdown, because the question has to be asked, why can't they rely on their contact tracing? Yes, we're dealing with the more infectious UK variant, but it seems as if they were a little bit slower off the mark in terms of putting some of those contacts of contacts and close contacts into quarantine and isolation. What we saw in Victoria in their latest outbreaks was a ring fencing sort of strategy where they not only sort of isolated and put the close contacts of positive cases into quarantine, but their contacts as well. And that really made sure that, when you got outbreaks in that situation, they were already in quarantine, so they didn't spread further. So perhaps, Queensland's contact tracing, has a little bit more work to do to get really up to scratch, so that they don't have to revert to these lockdowns, because, how many more of these are we going to see? Hopefully, once our vaccination, really gets going, this will be the last of them.
Yeah, we've just had an alert come through from Greg Hunt, the Health Minister, saying he'll be providing an update on the vaccine rollout in just over an hour's time. So plenty of issues and questions, no doubt, for the Health Minister on some of those issues shortly. Stay with us for that. Natasha, appreciate your analysis as always.
Thank you, Ashley.